Thank you for joining us today for COVID-19 and Georgia's homeless population impact and solutions. This is Brian Wallace with the Georgia Municipal Association. We are glad you are able to join us today to discuss how the current crisis is affecting Georgia's homeless and unsheltered population and how we can address this issue in our communities. First, I'd like to go ahead and briefly introduce today's presenters. First, we're quite honored to have Atlanta Mayor Keisha Bottoms with us today. Mayor Bottoms was appointed the chair of the Committee for the Homeless and Displaced by Governor Kemp as part of his coronavirus task force. The issue of homelessness has been a priority of hers and her administration since she became mayor. Also joining us today is John Keene, Deputy Chief Operating Officer for the City of Atlanta. He is a senior member of the mayor's administration. John's work for the city focuses on economic and workforce development, community planning, and housing and homelessness. And our third presenter today is Catherine Marchman. She's Executive Director of Partners for Home. Her career has been dedicated to working with individuals experiencing homelessness in marginalized communities for over 20 years. And we're very much looking forward to what all three of them have to say today. And recorded in this webinar will be made available on the GMA website along with the PowerPoint slide deck, as well as the recommendations of the Committee for the Homeless and Displaced. I'd also like to say, for the record, that the City of Atlanta and John Keene specifically really took the lead in putting this webinar together for us. The agenda will be as follows. Mayor Bottoms will overview the work of the Committee for the Homeless and Displaced and its recommendations. John will discuss the Continuum of Care and the partnership with the Georgia Department of Community Affairs. And Carolyn will discuss best practices and the key challenges in assisting the homeless during this time. We'll then have time for Q&A. So Mayor Bottoms, thank you so much for taking time out of your busy schedule to join us today, and we look forward to your presentation. Is the mayor there? John?
Yep, I'm here.
Maybe we should just hop to you. Let me move to your slide. There we go.
Okay, we can definitely do that and work through the connection issues with the mayor. So the mayor, when she comes back, she's going to talk about, really the work that was done over the course of the last several weeks in conjunction with the Committee for the Homeless and Displaced, and the amazing people that participated in that work, and the objectives that they laid out as part of that work, and ultimately the recommendations that they made to the governor. Two key parts of that overall set of recommendations that she'll talk to some of the great progress that's been made since were related to how across the state we needed to leverage the Continuum of Care infrastructure in order to effectively implement the recommendations. And the other piece was how the Georgia Department of Community Affairs was important to implementing those recommendations moving forward. And so I'm going to talk a little bit about that as well on the next slide. I imagine for many of you on the call, you're very familiar with the Continuum of Care. And, we thought it was important as part of this to reiterate the importance of the partnership and how an effective response to the COVID-19 pandemic for people experiencing homelessness requires close coordination with the Continuum of Care. HUD established the COC program to promote community-wide commitment to the goal of ending homelessness, and funding for these efforts are distributed in coordination with the COC. Georgia has 9 COCs across the state, and leveraging that partnership has been very important to successfully ensuring adequate shelter, resources, and care for the homeless. The COCs serve many purposes before the pandemic and continue to serve many critical purposes during the pandemic. They've assisted with gathering information on the greatest needs of the community, and so surveying and working with the service providers and working with people experiencing homelessness as well as understanding and leveraging data that they have collected through things like the point-in-time count. And that has helped in estimating the potential impact on this particular community. So they serve as a key hub for coordinating with nonprofit service providers and for providing uniform guidance during implementation. And they can also assist with tracking the results and the needs of individuals that may be coming out of the healthcare system. And finally, they can inform policy and funding decisions based on all of this. And, you know, Catherine, as the Executive Director for Partners for Home, also leads the Atlanta Homeless Continuum of Care. And so she's going to provide some good detail around how the Atlanta Continuum of Care has specifically worked to do these things related to the recommendations made by the committee. Next slide, Brian. So as mentioned, another key partner in this work is the Georgia Department of Community Affairs. And DCA has taken a leadership role in coordinating statewide implementation of the recommendations. And they are leading weekly calls with the COCs and state agencies to share best practices and coordinate actions. And so I would definitely ensure and encourage you all, as you work with your COC partners, to make sure that they are participating in those weekly calls with DCA leading that coordination. A key part of the discussion moving forward, both during those weekly calls, but as well as, you know, amongst you all in your municipalities, is going to be related to priorities and funding, you know, leveraging those federal funds that are being provided as part of the CARES Act. And there are emergency solution grant dollars, as well as HOPWA dollars that are very much related to serving individuals experiencing homelessness. And so how we prioritize and use those funds as part of a broader comprehensive effort is a key part of how DCA can be helpful in coordinating, as well as in many ways distributing those funds to municipalities across the state. They have also been great assistance in coordinating with other state agencies, and so we have leveraged them, and many of you all have likely leveraged them in coordination with other state agencies, in particular related to the needs of our homeless population. And so they have been a great partner in that coordination effort. And finally, they've put together some great resources, which again, you'll receive these slides afterwards, and so you can click on this link. But they've put together some great resources that can be referenced specific to the needs of people experiencing homelessness and the COVID-19 response. And so now I'll check in and see if the mayor has been able to join, and if not, we can transition and let Catherine continue and come back to the mayor. Mayor, have you been able to join with the audio?
I'm actually in on the video link. Can you all hear me now?
Yes, we can, Mayor. Thank you. This is Brian Wallace at GMA. We apologize for the difficulty.
No worries. And I apologize on my end as well. And thank you to John and to Catherine for leading this effort on behalf of the city of Atlanta and our state as a whole. And thank you to GMA for all of the work that you all have done to keep us informed during this pandemic. I was appointed as chair of the governor's task force for the Committee for the Homeless and Displaced well over, it seems like an eternity, but I guess it was just over a month ago. Joining me on that task force were representatives from across the state, including many of our health experts, public officials, nonprofit, and continuum of care leaders who serve as members, including Dr. Kathleen Toomey, Commissioner of the Georgia Department of Public Health, and Christopher Nunn, Commissioner of the Georgia Department of Community Affairs. Also, as I mentioned, John King, our Deputy Chief Operating Officer, and Catherine Marchman, Executive Director of Partners for Home, helped lead this effort. With this time this afternoon, I'd like to provide you with information on the purpose of that committee and just spend some time discussing the objectives and recommendations from that committee. As you all know, the coronavirus outbreak represents a significant health risk for people experiencing homelessness. Because they do not have homes and reside in public spaces and congregate in shelters, homeless and displaced persons are at a higher risk for exposure to the virus. This population has limited access to the preventative measures being recommended to help deal with COVID-19, including hand washing, home isolation, avoiding high-touch surfaces, and rapid access to public health care. In addition, people who are homeless and unsheltered are far more likely to have chronic underlying health conditions, making them more vulnerable to coronavirus. On March 24th, the committee submitted a set of recommendations to ensure adequate shelter, resources, and care for the homeless in Georgia. We established 6 objectives as a committee: prevent additional people from becoming homeless, support enhanced cleaning, screening, and referral, expand testing for high-risk individuals in areas, establish a reporting process specific to homeless and displaced persons, ensure appropriate options for quarantine and isolation are available, and ensure transportation options are available. 16 recommendations in areas such as policy, coordination, funding, and advocacy were developed to meet the objectives. They include everything from emergency rental assistance funds to ensuring access to personal protective equipment and testing kits, and ensuring that we have the needed beds for quarantine, isolation, and post-isolation shelter. These recommendations build upon the processes and resources that the Georgia Emergency Management Agency has and will put into place. They also leverage and further support the continuum of care infrastructure across the state to ensure the needs of homeless and displaced are considered. Since submitting these recommendations, the Georgia Department of Community Affairs has taken a leadership role in coordinating statewide implementation. And I'd like to acknowledge Commissioner Christopher Nunn and his team for their diligent work. As was recommended, they are leading weekly calls with the local Continuum of Care and state agencies to share best practices and coordinate actions related to the committee's objectives and recommendations. During our most recent committee meeting, which was last Thursday, in fact, we discussed the following efforts to deploy state funds and coordinate actions across the state. The CARES Act, which is providing our state with additional funding for the homeless and displaced through supplemental allocations to the Emergency Solutions Grant and Housing Opportunities for People with AIDS grant. Across the state, these funds will prevent additional people from becoming homeless, help our existing homeless shelters stay open, clean, and safe, and provide additional emergency lodging for people to safely isolate or quarantine. Our state also has led the way in developing and integrating screening tools into the Homeless Management Information System, a tool that has facilitated almost 7,000 screenings across Georgia's network of service agencies. The DCA has worked with the Georgia Emergency Management Agency to accommodate walk-through testing for our homeless without vehicles in places like Albany. Testing for the homeless is taking place across Atlanta thanks to our partnership with CDC, Mercy Care, and the Fulton County Board of Health. 16 shelter sites and 2 unsheltered sites have held testing events in Atlanta with about 2,000 people being tested. That is more than half the homeless population in the city of Atlanta. We are also adding to the number of testing sites in our city. Finally, we continue to be proud of several nation-leading efforts within our state to provide safe options for isolation and quarantine. These include the City of Atlanta's partnership with DPH to provide isolation and supportive services for our homeless. The City of Albany remains a hotspot for COVID-19 in our state, and GEMA has established a quarantine hotel there. And Atlanta also now has a second hotel established so that high-risk, unsheltered people can safely quarantine. In closing, I want to say how proud I am, and we are, the work that's being done by our committee. And I greatly appreciate the continued coordination and leadership of DCA in the implementation of these resources. Thank you.
Thank you, Mayor. Now, Catherine, you ready to go?
Yes, I am. Would it be possible to advance to slide 9 first and then go back?
So which one's this one?
The graphic. Nope,
Yes.
2 more slides. There you go, right there. Yeah, thank you. Thank you, Mayor Bottoms, for your leadership, and thank you, John, for being really just such an incredible partner in all of this work. And thanks for you all for being here with us today. I'm happy to share some of the work that has been underway here in Atlanta, and thought it would actually be best to maybe start here with the graphic that gives you kind of a high-level overview of the work that's being done on the ground. And I want to start by saying first, really all of this work has been through just an incredible partnership with some key entities and collaborators on the ground. Obviously, our Continuum of Care has been joined at the hip with the mayor's office from day one. And so we've really been able to do the work we've been able to do through that strong partnership and that open door at the city to be able to really make all of this possible. In addition to that, we have been working very closely from the very beginning with our local healthcare for the homeless organization, which is Mercy Care here in Atlanta. And I would strongly encourage local partnerships with your FQHCs in your local communities, if to the extent that that's possible. We've also been strongly partnered with our public hospital system, which is Grady, along with some of our other area metro hospitals. In addition to that, we've been closely coordinating with our local Board of Health at Fulton County, as well as some strong partnerships at the CDC, who are providing a deployment of testing here locally, which I'll talk about more in a minute, ongoing training and support, and just ongoing guidance and advisement. In addition, we've had head technical assistance that has been dedicated to the Atlanta Continuum of Care, and which I believe has been provided to other COCs all around the country and should be accessible through your COC locally. And then nationally, we have been closely coordinating with both the National Healthcare for the Homeless Council, which is providing ongoing webinars and education and information that's been vital to our work on the ground, as well as through our National Alliance to End Homelessness, the partnerships and connection to other cities around the country, and learnings from them about what they're seeing, what they're doing, what's working, what's not working, has also been critical and pivotal to our work as well. So I'd strongly encourage those linkages and connections if you have not done so already. And with that, pivoting to the slide here, I think this is a really good graphic in terms of understanding really what we're leading currently. And that is grouped into a few different categories. And I'll talk you through the work of the recommendations through the governor's subcommittee in just a moment. But really it's sort of divided by isolation and now non-congregate shelter for individuals that are high risk, transportation to and from all of the different entities, because many individuals are no longer providing transportation for individuals experiencing homelessness. So we have dedicated transport through Grady that we are paying for to transport individuals to these various locations. Testing being provided again by Mercy Care, as well as our local Board of Public Health and through a special deployment of the CDC that actually just ended on Friday. But as I'm sure you all are well aware, testing is absolutely critical to everything we're doing, and that's no different in homelessness. And then some specialized work that we're doing in encampments and food distribution. So we recognized early on that there was an immediate dearth in the availability of food to individuals experiencing homelessness due to many of our food and service providers reducing operations and in some cases shutting down altogether. And so we have stood up through a partnership with the Atlanta Community Food Bank. So again, another critical partnership through our local food bank, who then contracted with a large caterer who has the capacity to stand up large volume of food production very quickly. And they produce upwards of 1,200 meals per day. And we are leading a food distribution network every day where that food goes out daily to over 80 encampments and unsheltered locations throughout our community to ensure that no one is going hungry during this time. We are also working with our shelter providers and other providers to ensure that they have the food supply that they need, as well as other supplies, and I'll talk a little bit more about that in just a moment. So that's kind of a high-level overview of the work that's being done, but I'll walk you through some details. So we could maybe go back 2 slides to slide 7. Yep. So starting with the first recommendation that the subcommittee made, which was focused on preventing additional people from becoming homeless. So obviously one of our biggest concerns through this pandemic that I'm sure you all are sharing is although there have been some great policies that have been put into place around staying evictions, and kudos to our mayor for leading the charge on that. We are very concerned about more people coming into our system. And so it's absolutely critical that our communities now more than ever coordinate and align resources to ensure that we prevent that from happening. So some key recommendations here that we have made are one, making sure that all of your stimulus funding that's coming down through entitlement dollars, whether it's ESG, HOPWA, or CDBG, are going to be aligned to support that effort. And some ways to do that are, obviously ensuring all funded agencies that get those dollars either currently or who will get new money through the stimulus funding are lowering barriers to accessing those funds as much as possible, but also using the same criteria across the board to access those dollars. Another recommendation that we are making for these funds is utilizing one hotline to access the funding. In other words, instead of having consumers call 10 different agencies in 10 different ways on potentially 5 different days and times, creating one unified hotline where all people can call to connect those resources and where the resource is provided on the back end to the hotline, making it a streamlined way to actually access those resources and funds. So that is something our community is working on currently. It is not stood up yet, but those are recommendations that we are making to the prevention providers. And the other recommendation that we're making along those lines is to have private funds do the same thing. So any money that you align on the public sector, asking private philanthropic dollars to align in the same way, asking for the same outcomes, asking them to participate in the same coordination, again, so that you're streamlining the process and ensuring it's as easy as possible for the consumer to access. Obviously, having one point person to run all of that and coordinate all that, or one committee or group to do that and work together is absolutely critical. Moving to supporting enhanced cleaning, screening, and referral. So we did a few things very early on, and hopefully your communities have already done this as well. One was we implemented a symptom screening tool across our entire continuum of care. And DCA, through our HMIS lead, was able to upload that into our data system, Client Track, so that all of our homeless service providers have access to that. And we rolled that out, I think, within the first week of the response. And now that tool has actually been posted on the HUD Exchange website as an example of a tool that communities could utilize in their cities as well. So symptom screening across the board, across all service providers, was something that we did from the very beginning, and is an easy way to begin to identify individuals that are touching your systems or seeking resources and shelter in your systems who might be symptomatic. Also making sure that obviously all your service providers are beginning to use that tool in HMIS is a great way to be tracking how your providers are using the tool, if they're using it, and to be able to track data about individuals who may be presenting to your system with symptoms. A couple things that we also did early on and are continuing to do was, in an effort to coordinate supply and resource procurement, we have been surveying providers about their needs. So soup to nuts, from soup kitchens to shelters to permanent housing providers, we have been surveying them on a regular basis about what their needs are, whether it's cleaning supplies, personal protective equipment, or food or otherwise, so that we are all on one page in terms of what those needs are, and so that we could then issue one large procurement through an entity that has higher, larger buying power. And we have continued to communicate that to our COC providers on a regular basis, because one shelter trying to access PPE is obviously not nearly as enticing to a PPE provider than, say, one large provider like a hospital system or Mercy Care, for example, who has a large hospital network that they can access in order to help procure larger amounts of supplies, cleaning supplies, and PPE, et cetera. So I would encourage you to do the same. Make sure that you are accessing your provider's needs so that you can more strategically procure those types of resources and supplies. Additionally, as I mentioned, in addition to the food coordination, we have had coordinated efforts to get out those supplies and resources to our shelters, as well as to individuals who are unsheltered. So we've held several now days where we had, on a Monday from 1 to 3, we just had an open time period where shelters and providers could come pick up masks, and then also disseminate things like hand sanitizer to individuals who are unsheltered. So providing that level of coordination and support, I think, to providers ongoing has really helped ease tension and stress and frustration on their end, so that they are freed up to be able to do the hard work of providing direct service. An additional item that we did in this category was really just providing educational materials, especially for individuals that are unsheltered. So we created very graphic, heavy material, especially for individuals that might have literacy issues or concerns. So really just depicting what it means to social distance, what 6 feet looks like. That might sound silly, but helping people really understand what it actually means, particularly if you're living outside, when that can be difficult or challenging to social distance. So another thing that we did early on with our shelter providers was giving them that material, asking them to canvas our entire city geography, posting that material and handing it out along with hygiene kits and sanitizer, so that individuals who are outside who might not be accessing services regularly were educated and informed about what was going on and how to protect themselves. The next recommendation, arguably the most important, is expanding testing for high-risk individuals and areas. As Mayor Bottoms mentioned, we have really been incredibly fortunate to have had Mercy Care on the ground early on, and their ability to get a CDC deployment here for the last 3 weeks. So I don't know to what extent other communities would be able to do something like that. However, in the last several weeks, our local Board of Public Health has also been able to stand up testing in other shelters where the CDC was not able to go to. So it's really been an incredibly coordinated effort. Tom Andrews at Mercy Care called it divine intervention. I would have to agree with him. As the mayor said, we have now done just shy of 3,000 tests. Our point in time count is around 3,200. So we've arguably tested almost every homeless individual in our system at this point. Over 30 sites, both our large congregate shelters as well as many smaller shelters, as well as about 10 unsheltered sites. We targeted our food service locations for unsheltered testing, where we knew we had large volumes of unsheltered individuals that came regularly or come regularly for food. A suggestion on testing: not every person experiencing homelessness is eager to get a test. Some individuals are skeptical of what COVID-19 even is. Some are might have some paranoia about what it might be and might not be. So going into testing in our with the individuals we serve with eyes wide open, we offered a testing incentive to incentivize people to come get tested. We partnered with Chick-fil-A, who, in addition to the meal that was already being provided, brought hot Chick-fil-A sandwiches, and most people can't refuse that, myself included. And in addition to that, we bought $5 McDonald's cards as well. So individuals coming to get a meal were offered both of those incentives to come get a test in addition to that. And so I cannot underscore the importance of getting testing out to the homeless community as soon as humanly possible. If you have not seen some of the news coming out of Boston and San Francisco in particular, they had in the shelters where they were testing large numbers of asymptomatic individuals. So they're seeing a lot of spread in congregate shelters of individuals without symptoms. And I strongly believe that our testing early on is going to enable us to be able to prevent that from happening. And of the almost 3,000 tests that have been done so far, we have only had 36 positive cases. And then going to the next slide, what we have done with, once those individuals were identified with a positive COVID test, we stood up quarantine and isolation facilities for those individuals to safely isolate. So we first stood up an isolation hotel, and that was in partnership with the Department of Public Health. We then were able to use some of the initial emergency funding that the City of Atlanta issued early on in the pandemic to provide for the cost of staffing that facility, and the Department of Public Health is paying for the room and board there. Every positive individual that is identified is contacted. In this case, if they were in shelter, the shelter was contacted, who then contacted the individual. We then worked through the local Board of Public Health, who received the test results from the testing agency, which in this case was Mercy Care. And then we coordinated transportation to the isolation hotel where the individual was able to safely isolate. For unsheltered individuals, we created a reporting process where when they came for testing, we gave them a flyer. And if they have a cell phone, we would call their cell phone, and we captured that at the testing intake. If they did not have a cell phone, and many individuals experiencing homelessness do not, then we created a hotline, and we embedded that hotline to be staffed at our Healthcare for the Homeless organization, which is Mercy Care. So that could be done at your local FQHC, so that clients would be instructed to call that number to get their test results. We actually found out where they were, and then we sent transportation to pick them up, even if it was at a street corner or under a bridge or wherever they were located. We've been able to actually track them down and then get them safely connected to isolation. The isolation hotel has the ability to go up to 170 individuals. And then we've also stood up a non-congregate hotel, which has been made possible through the mayor's executive order that was issued a couple weeks ago now, for an additional $1.5 million to support that effort. We knew that we had to also support individuals who do not have the ability to safely isolate, either outside or in congregate shelter. And so we are targeting high-risk individuals, either 65 years of age or older, or who have underlying medical conditions that would make them high risk for the effects of COVID if they were to contract it. We are currently working with our street outreach teams to get those high-risk individuals into that non-congregate shelter. That money was matched by the private sector, and so the private funding in that case is also paying for the staffing and operating for the non-congregate hotel, while the mayor's 1.5 is paying for the room and board for that facility. In that facility, we can go up to 250 individuals. And we're working to make sure we're aligning the stimulus entitlement dollars to support permanent housing placements for individuals when they leave that facility. So again, going back to that really the critical nature of aligning those dollars and making sure that they're supporting all of these efforts and that they're coordinated. And then I already spoke on transportation and how transportation is working to connect and link individuals to the necessary facilities. We partnered with Grady in this case, and we felt it was important to make sure that it was a medical provider so that they knew how to safely transport people who might be positive, and that they knew how to safely clean and sanitize the vehicle in between transport. Finally, I would just add one other really, really critical thing that we implemented, and that is communications. We do a twice-a-week phone call with our COC that is very widely attended. We usually have 75 or more participants on the call every Tuesday and Friday morning. It's just a 30-minute call where we update our providers on what's happening, what's changed, and offer the opportunity to share information, share best practice, and ask questions, and get, really just have an opportunity for improved communication. We send a follow-up email with the minutes of that call twice a week. And then we've also stood up a page on our website where we're regularly updating information. And so I think I've gone on maybe a little bit too long here, so I'm happy to pause there and open it up for any questions.
Great. Again, this is Brian Wallace at GMA. There is one question that was that someone typed in, and I'll ask. It's to the mayor, but it may be John or Catherine may be able to answer that along as well as the mayor if she's still on. And it says, Mayor, can you ask and provide education options to learn contact tracing? There are many homeless that could turn into assets for our community, paying $20 to $30 per hour. Contact tracing is going to be a new norm until a cure is available. But the reality is, with the cure of COVID-19, there will be more viruses that are just around the corner. If this pandemic hasn't shown us it should, to be better prepared. So any of the presenters have any feedback on that question?
Yeah, I have some thoughts, and then I'm going to ask Catherine to add to them. But so this is a great idea, and something that I think builds off of some discussion that we've started related to our workforce development agency and some funds that have been part of, the overall CARES Act, which relate to assisting workers in finding work both now in helping related to the response, which obviously this idea directly relates to, as well as post-response. There's also, the city had received some workforce development dollars specific to placing both training and placing individuals experiencing homelessness into work experience and other things. And Catherine and her team have been a core part of that. And so I think ideas like this fit very well into that, thinking about ways to use those funds and pair those with, people who may be experiencing homelessness, but, have a great opportunity to be trained and be given skills that can help them ultimately support long-term permanent housing, which is a key part of the goal that Catherine and her team work on every day. So Catherine, feel free to add to that.
No, actually, I think you answered it very well, John. I don't really have much to add, but I think that's a great point. In addition to that, and definitely a tangent, I would just say a couple other things we're thinking about. One, staffing has been a big challenge if we're talking about challenges, just for both hotels actually in the current environment. And so we have also been working through this partnership with WorkSource to open up opportunities for displaced workers to get into the workforce. And contact tracing is I think that's actually a great idea, and we're looking to ramp that up, and have been doing that in partnership with the CDC, at least for the people who have come in with positive test results to the isolation hotel.
Thank you. I got another question here. Actually, let's go. Jerome Burkett had raised your hand. Do you have a question? You should be unmuted. Jerome. I'm going to go back to another question. This is from Lynn Norton, and I'll ask any of the presenters to respond. Great work. What great work you're doing. Thank you for your commitment. What are you seeing from an increased needs for homeless families with minor age children? What kinds of solutions are being considered to support them? For example, with isolation and quarantine for positive tests. How does that work in the case of a single parent with children?
Yeah,
great question. And Catherine, yeah, you're well positioned to answer this one. I know you've been dealing with this directly.
It's definitely a very good question. It's a very hard question to answer, and one that we have been grappling with actually. Sorry, domestic turmoil.
I was about to say you were distracted by your own children there, I think.
Exactly, children and the dog. So, we have been fortunate not to have any positives in our family shelters. And what we did originally was we asked our family providers whether or not they have the capability to isolate a family if they were to come up positive. And so the majority of our family shelters fortunately have single rooms, and the biggest challenge was going to be around bathrooms. And so most of them were able to work through that in terms of coordinating one bathroom that would be used by, a positive family, for example. So, that's what we're doing on isolation. When we go back, and we will be doing some retesting, if it comes out that there are now newer volumes of families, who come back positive, we may have to relook at that and look at putting families in the hotel. And the other part of the question, I think, is if a mom were to test positive, for example, or the guardian, and the child is negative, and what we did with that to kind of, again, a very hard question and a hard answer, and we didn't really have the answer on that. We started with making sure that the doctors who were going in and doing testing at family sites were educating families about their options. And just like parents all the time are having to think about, you know, how they would care for their children in an emergency, we began educating families about that from the beginning, and letting mom know, look, there's the potential that you could be positive and your child could be negative, and here's your options. And those were essentially, you know, you could continue to care for your kids and you'd have to take the necessary precautions, and there would be a risk that you would, infect your children. Two, you know, if you were to do that, you're also might not be feeling very good, because you could get symptoms and feel pretty crappy. And so, you know, what is that going to be like, taking care of your kids while you're sick? And do you have family or other resources? And then three, we did reach out to DFACS, the Department of Family and Children's Services, and we, you know, talked through the potential of getting a respite opportunity, and we actually haven't resolved that answer to date. As far as resources, you know, we're making the recommendation that the city prioritize as much of its emergency solution grant as possible for rapid rehousing that could be used for families as well as for single adults, in order to expedite getting folks out of homelessness as quickly as possible. And that's really our recommendation there.
Thank you. Jerome, if you're unmuted and you want to ask your question, please go ahead. Jerome, are you there? We're going to go to another question. Are there, this is from Carol, are there any shelters for men with children?
Yes, in Atlanta, we have shelters for men with children. Salvation Army takes men with children. The Donna Center takes men with children. Nicholas House takes men with children.
I left them at the house. So.
And another question, this is from Henry Lust. What is the status of progress in achieving the 6 established objectives of the committee?
Great. Thanks, Henry. And I'll take that one, and then Catherine may have some things to add to it as well. So let me just start at the kind of very highest level. And, you know, I'll make this statement based on the last conversation that happened with all of the COCs. And DCA, again, is really leading the coordination of those discussions. My takeaway from that discussion, where they went through many of these one by one and got feedback from COCs on progress they were making, was very positive. I felt like overall across the 6 objectives that the COCs and the communities across the state had found ways to be able to address each of these. Not all kind of one cookie cutter approach, but a lot of similar things that they were benefiting from mutual discussion and coordination on. And so overall, I felt like the takeaway that I had from that conversation was across the state, there was a lot of positive momentum and success around each of these 6 areas. Let me just quickly kind of touch on them and give you a sense. And my take is obviously a little bit biased towards Atlanta, since that's what I know best. But I think there's elements of it that are applicable to the work that the other COCs are doing across the state, and DCA is helping to lead. So the first one, in terms of preventing additional people from becoming homeless, there's been a lot of success in that in the kind of during the response crisis mode. Obviously, the eviction moratoriums and other things, both from federal funds as well at the local level, like the one that the mayor established, and the work that she's done to work with our judges and others on that as well. So a lot of short-term success. I think where we're looking now is beyond, you know, the moratoriums, and making sure that the systems are in place, the funding is in place to ensure that the people that are impacted economically by this have the assistance available, both at the federal, state, local level, through philanthropy coordinated. And Catherine talked about that. So early success, and we've just got to keep our eye on it, because a lot of of that is going to be, you know, the next kind of challenge as we get beyond the response. In terms of supporting enhanced cleaning, screening, and referrals, you know, the numbers in Atlanta are very positive, and Catherine talked about that in terms of the number tested and the number of positive cases that came back. And so that gives us at least an indicator that the work that they did early on made a difference in helping people in shelters stay safe, helping the unsheltered stay safe. And that was education, cleaning, sanitation supplies, other things. So the numbers there kind of help us understand that there was a lot of good work done early on that was successful. Expanding testing, another one where obviously in Atlanta have had a lot of success there, and there's a lot of work going on across the state to further expand those tests. And you know, the mayor mentioned one example from Albany that DCA has mentioned to us, that you know, they've been helping GMA think about as drive-through sites are being established, how do we ensure that those sites are accessible for individuals who don't have vehicles and may be homeless? And so that's got to be a core part of it. Establishing a reporting process specific to the homeless and displaced. This has been certainly a challenge, and you know, Catherine can talk well to that. And each community, I think, is figuring it out differently, because ultimately a lot of it is relationships and relationship building with those healthcare providers. And so I think, you know, we've had success, but certainly there's a lot of room for improvement in terms of automated systems or other ways to ensure that the data is being collected so it's clear, and flagging things in the system. Right now it's very manual, and obviously as we think about beyond this, looking for ways to make that more automated is more ideal. And it also ensures better quality data. Appropriate options for quarantine and isolation. We've got a lot of positive feedback across the state in terms of various ways that folks were able to do this for people experiencing homelessness. Obviously, we talked about the ways that we've done that in Atlanta. The numbers, thankfully, did not play out to be nearly as high as what was projected based on some of the point in time data, as well as projections related to total population that would be symptomatic and have the requirement for isolation and quarantine. And so, so far from what we've been able to see, what has been put in place across the state has been adequate. And then finally, transportation options. And one of the calls the DCA had just, I think it was last week, was talking about various ways that local COCs had put in place options for transportation. It was a challenge in some communities. Obviously in Atlanta, Catherine talked about, we contracted with Grady. And so, you know, sometimes that's an option and sometimes that's not with your local healthcare provider. There's been discussions about figuring out partnerships with ride sharing applications and other things. And so that's one where I think, you know, people have gotten creative to find ways to make sure that transportation is available. So I think the consensus I heard from the group was that it is, but you know, figuring out the right solution wasn't easy in every municipality across the state. Catherine, was there anything you wanted to add to that?
No, I think you covered it, John. Thank you.
John and Catherine, if you have like one more minute or two, I want to combine two questions that I've gotten, and one's from Kelly, and she asks, how can shelters in the southern region like Valdosta obtain COVID-19 assistance? And the other question from Gail is, has there been any thought / guidance given to rural communities that do not have a shelter? So I know, John, you're Atlanta centric, but any insight you have on that, or Catherine, we would appreciate that.
So I can take the first one related to southern region Valdosta, and a couple key things that I want to make sure that when we send out the slides that you have access to that information and can reference it. You know, the balance of state COC is a core support related to areas that don't have dedicated COCs. So leveraging that relationship with the balance of state COC, which ultimately is run by the Department of Community Affairs. And so I think, you know, the kind of two pieces that I talked about, which related to how you leverage your COC and how you leverage the Department of Community Affairs, are very applicable here. They're seeking to make sure that they're giving a lot of support to municipalities and ultimately to the service providers that are on the ground doing the work across the state. And so DCA is going to be a critical partner in the work in places like Valdosta.
Yeah, I mean, I would
Go ahead, I'm
reiterate
sorry.
the same thing. No, I think John's point is right on. As far as the question about if you don't have a shelter, I'm not sure I fully understand the question, but you know, I guess I would focus my efforts then on my homeless service providers and making sure that those entities are doing symptom screening, and also, again, supporting that education and information sharing with individuals who are marginalized in your community or might be doubled up, or vulnerably housed or insecurely housed. If you are working with families that are have multiple households in a smaller apartment or household, helping to make sure they understand how to be safe even in an environment like that, to the extent that it's at all possible. And then also trying to make sure that they have access to supplies and PPE as much as possible as well.
Well, thank you. Again, this is Brian Wallace at GMA. We've gone a little bit over our time. We want to thank the Mayor Bottoms, John and Catherine for their time and answering these questions. And thank you everyone for staying online while we had our little technical difficulties. I appreciate that very much. We had some great discussion. Again, we will get information out. We will put it on the website. We'll do a video of this webinar, and we'll have the slide deck, and we will have the PDF of the recommendations of the committee that that Mayor Bottoms chaired. So thank you again, and we appreciate your participation. Thank you.